Hi, I'm Dr. Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina. And today what I'd like to talk to you about is neck pain, some of the causes of neck pain, and some of the ways that we've been able to help it in our office. So neck pain, there are many different causes of neck pain. One of the most common things that we see is something called a disc herniation. Now, the bones of the spine in the neck, they stack, the bones of the spine stack one on top of the other. Between the bones of the spine, there's what we sometimes think of as a spacer. It's called a intervertebral disc, or a spinal disc. That disc, I'll show you on the model here. This is a representation of the two bones, the disc between it. You can see from the top, the disc has a tough cartilage wall, and in the center, there's this jelly-like substance. Okay, what can happen with the disc herniation is that this outside wall can break down, and this material can squirt out. That can create a lot of pain, inflammation, muscle spasm. It can create pain and numbness down the arm because the nerve gets compressed. And that's one of the most common injuries that we see and conditions that we see people for in our office. There are a lot of other causes of neck pain that we see as well. Another reason for neck pain is degenerative disc disease. Now, as I showed you, in this model, this is a nice healthy disc. It's really thick. There's a great space for the nerves. The disc gives height and separation of the hole here. It makes the opening for the nerve. It makes it a lot more patent or open, right? So what happens though is over time our spine can break down and the space for the disc can get much smaller. That can create problems because it makes the hole for the nerve much smaller, and it can create compression of the nerve. It can also cause these joints on the back of the spine. You've got two joints, you've got one here and here, and it can make them arthritic, and it can cause pain and inflammation. So that's degenerative joint and degenerative disc disease of the spine. Those are actually two more problems other than disc herniations that we commonly see. And just to show you a disc herniation, remember I showed you the disc at the top, right, and how nice and round the material in the center is, like this, right? This is the healthy one. Notice that this one, that material has worked its way back and it's tearing through the layers of the disc. And when it comes out and it herniates, it can create a lot of problems. Now, those are probably some of the most common reasons that people seek care in our office. Other things that we see are that they have lost the curve in their neck. Most people should have a forward curve, a slight bend in the neck. We actually measure that using a computerized program in our office. We take x-rays and we can measure it, and we can see if you have a healthy curve in the neck or not. We can measure exactly where the breakdown in that curve is, and we can help you with rehabilitation. It's really important to understand that if your neck is straight, or if it's bent forward, what we call loss of the curve or reversed curve, that changes the way that your spine is carrying the weight of your head. And this can happen in your lower back too. The lower back can straighten, but in the neck we see it a lot, especially after injuries like whiplash injuries, or where you've had a fall or some kind of trauma that caused a whipping of the head or a whiplash. And the reversed curve, the buckled curves, or the straight neck, that actually changes the way that your spine carries the weight of the head, and it can lead to degeneration of the joints at the back of the spine. It can also break down the discs at a faster rate, and it can create and lead to osteoarthritis. A lot of problems. So we do look at the curve. We want to see if you have normal mechanics, and just make sure that we do everything that we can to give you the best opportunity to have a good quality and long, healthy life. So I'm Dr. Shook. If you have problems with your neck, if you're having neck pain, if you're having nerve pain down the arm, anything that's going on, that's neck related, if you're having pain, if you're having headaches, we may be able to help you with some of the approaches that we take. And we utilize a lot of different approaches for neck pain. We have several different therapies. One of my favorite therapies to use is something called non-surgical spinal decompression therapy. And it sounds kind of intimidating, but don't be intimidated. It's a very gentle therapy where you gently rest back on a specialized table, and we place your head in a carriage. It's just this thing, you rest back, and it just gently will support the head, and it gently lifts and pulls, and it does so in a rhythmic fashion. To what it does is it takes pressure off of the joints of the spine. So if these were the bones in your neck, and these are actually from the lower back, but we can illustrate the point here. So if these are the bones from the neck, and this is the disc, and it's narrowed, and you're getting some pressure on the nerve here that may be causing pain down the arm, our therapy will gently pull and create some separation, and then allow it to come back together. Create some gentle separation and then allow it to come back together. So it pulls nutrients into the disc, takes pressure off the nerve, takes pressure off the joint, and that ultimately can result in decreased neck pain decreased arm pain, and improved range of motion. So it's really, really helpful for a lot of different problems. We do have chiropractic adjustments available if that's something that's appropriate. We can always discuss that. That's not something that has to be done. I know some people are hesitant and worried about that, and that's okay. It's appropriate for some cases, but if that's something that you prefer not to have, that's not an issue at all. We can always utilize a lot of the other therapies we have, like non-surgical spinal decompression. We can utilize laser therapy. We can utilize other therapeutics that we have in our office. So I hope this helps you to better understand some of the things that we might do for neck pain and some of the problems that you might experience. If you have any questions or if you'd like an opinion on your case, you'd like to me to take a look at you, then just give us a call. Our phone number is 828-324-0800. You can also find us at hickoryspine.com online. You can learn more about what we do and see if it might be a good fit for you. But if you need help, I'd be happy to take a look, and I look forward to meeting you. Hope you have a wonderful day. Thanks.